That picture frame, those hooded strings, they are driving me insane. Unequal pizza slices, fonts of different sizes, it's more than I can take. Missing parentheses, uneven caprice, Googling askew. Bags opened from the wrong end, should be recognized as a sin, along with an unsolved Rubik's Cube. I gotta make things right, make it the way it's supposed to be. It's my OCD. Toilet paper facing inwards, unsynchronized, synchronized swimmers, a closet that's not organized. Pills removed out of sequence, sideburns that are not even, that one rebel mini blind. I gotta make things right, make it the way it's supposed to be. It's my OCD. I gotta make things right, make it the way it's supposed to be. It's my OCD, baby. I gotta make things right, make it the way it's supposed to be. It's my OCD.
Obsessive-compulsive disorder, or OCD for short, is defined by the DSM-5 diagnostic criteria as a presence of obsessions, compulsions, or both. Obsessions being defined as a recurrent and persistent thought, urge, or impulse that is experienced at some time during the disturbance as intrusive and unwanted, and that in most cases causes marked anxiety or distress. Also, the individual attempts to ignore or suppress such thoughts, urges, or images, or to neutralize them with some other thought or action. Compulsions are defined by repetitive behaviors or mental acts that the individual feels driven to perform in response to an obsession, or according to the rules that must be rigidly applied. The behaviors or mental acts are aimed at preventing or reducing anxiety or distress, or preventing some dreaded event or situation. However, these behaviors or mental acts are not connected in a realistic way with what they are designed to neutralize or prevent. They are clearly excessive. Obsessions or compulsions are time-consuming or cause clinically significant distress or impairment in social, occupational, and other important areas of functioning. Obsessive-compulsive symptoms are not attributable to the psychological effects of a substance or another medical condition. OCD is the fourth most common psychiatric illness with a lifetime prevalence of 1 to 3%. It was identified as the anxiety disorder with the highest proportion of serious cases, 50.6%, and as a leading global cause of non-fatal illness burden by the World Health Organization in 2006. This means that 1 in every 2 cases of OCD is classified as a serious case, and OCD is a large problem across the globe. OCD has varying levels of insight, ranging from good or fair insight to absent insight. A person with good insight understands that their beliefs are definitely or probably not true, whereas a person with absent insight is completely convinced that their obsessive-compulsive disorder beliefs are true. A patient can fall anywhere along this spectrum. Both biological and environmental factors are important in the etiology of OCD. Environment and biology together are studied during twin and family studies, while biological factors are attempted to be discerned through genome-wide significance studies. OCD family studies have been conducted since the 1930s, providing a strong evidence for approximate 4 to 10-fold OCD risk increase amongst first-degree relatives of OCD-affected children and adults respectively, as compared with the relatives of controls. Twin studies conducted in the same time frame have concluded that obsessive-compulsive symptoms are heritable, with a greater genetic influence in child onset, 45 to 65%, than in adult onset OCD cases, 27 to 47%. While trying to find a genome-wide significance, study results have been somewhat encouraging, identifying peaks on chromosomes 3q, 9p, 10p, 15q, and 19q for OCD, and on chromosome 14 for compulsive hoarding. However, none of these peaks exceeded the threshold for genome-wide significance, and only the 9p peak has reached suggestive significance in more than one sample. In a study published in 2012 by Macmillan Publishers Limited, no single nucleotide polymorphisms, or SNPs, were identified to be associated with OCD at the genome-wide significance level. However, a significant enrichment of methylation quantitative trait loci and frontal lobe expression quantitative trait loci was observed with top-ranked SNPs, suggesting these top signals may have a broad role in the gene expression in the brain and possibly in the etiology of OCD in the biological factors. The psychological factor of etiology was studied in a self-report experiment published in 2013 by the Journal of Personality Assessment, where it was found that emotional stability and benevolence are negatively correlated with obsessive-compulsive symptoms. Meaning, as you see an increase in obsessive-compulsive symptoms, emotional stability and benevolence fall. OCD is most commonly evaluated through the use of scales, such as the Children's Yale Brown Obsessive-Compulsive Scale. The CYBOCS assesses obsessive-compulsive symptom severity over the past week using scores that range from 0 to 40, with higher scores corresponding to greater severity. Symptoms are then also rated on their terms of frequency, subjective level of distress, interference with functioning, attempts at symptom resistance, and perceived ability to control obsessions and compulsions. The CYBOCS has been utilized as a primary screening and outcome measure in most pharmacotherapy and psychotherapy trials for pediatric OCD. Although the CYBOCS is the gold standard rating scale in the field, it does not have an individual patient basis, meaning there is no guideline for interpreting the severity across a range of treatment-seeking youth. Another form of assessment is the Clinical Global Impression Scale Severity, the CGIS, which is a single-item clinical rating of global OCD severity based on scores ranging from 0, no illness, to 6, serious illness. In contrast to the CYBOCS, which assesses severity of obsessive and compulsive symptoms in the past week, the CGI severity is a global assessment of overall OCD illness in which the clinician considers a broader continuum of functioning, including impairment, psychosocial functioning, and overall presentation relative to other youths with OCD. Often with OCD, there is a lag of approximately 10 years between the onset of symptoms and the time a person seeks professional help. Because of this large gap of time between symptom onset and treatment, OCD often runs a chronic and disabling course, which compromises an individual's well-being and their ability to function in society, having a detrimental impact on both their lives and the lives of those close to them. The treatment of OCD involves pharmacotherapy, typically serotonin reuptake inhibitors, and behavioral therapy of exposure and response prevention, or ERP. ERP is the treatment of choice when symptoms are mild to moderate. A combination of both pharmacotherapy and behavioral therapy are used when symptoms approach severe. Cognitive behavioral therapy often has the best outcome because it teaches patients to restructure their worldviews outside the confines of OCD. The future of OCD treatment seems to focus on better cognitive-based therapies. One option that is being explored is family-inclusive treatment, or FIT, which has been shown to have a large overall effect on OCD symptoms and global functioning. Some research has found that individual family treatments, rather than groups, and FITs targeting family accommodations of symptoms versus those that did not target them, were associated with greater improvements in patient functioning. These preliminary findings indicate that more time and effort should go into the study of family-inclusive treatment for OCD patients. Unsurprisingly, a study in 2011 found that patient adherence was positively correlated with cognitive behavioral therapy outcomes, meaning that if a patient adhered to between-session assignments, it significantly predicted treatment outcome, as did early patient adherence and change in early adherence. In conclusion, OCD is both a debilitating and widespread psychological disorder, meaning it deserves attention both from the media and from the academic community as well.
Enjoy.